from a participant spotlight to a charity spotlight we go. I've got her on the telephone with me right now. Her name is Terra Scheer. She's the communications officer from the BC Children's Hospital. And Terra, thanks so much for making time to join us today. You know, everybody is aware of the name BC Children's Hospital, but perhaps as a result of our conversation today, we might be able to raise the profile a little bit. How does that sound to you?
That sounds great. We love hearing from people around the province because we are really BC Children's Hospital.
You're based in Vancouver, right?
We are based in Vancouver, but we treat children throughout the province as well as Yukon.
You know, Terra, things sure have changed over the years. Compared today's state of healthcare to even 50 years ago, technology and medical advancement sure have made a big impact on how we treat patients today.
Absolutely. That's a good point, Dean. And the thing is, we are be able to save children that, like you said, 30 years ago we wouldn't be able to save. Cystic fibrosis is a perfect example. Children 40 years ago were only living to be about 20, and now they're living well into their adulthood because of the technologies that and the medicines that we've been able to develop over time. It does, however, mean that children are here at the hospital for chronic issues because we were able to successfully save their lives, but it means that they have ongoing issues that we've never seen before. So that is taking up a lot of research time to see how we can continue to improve on their lives and improve the medicines that we're providing and just keep that quality of care going throughout the rest of their lives. But it does mean more visits to the hospital that we've never seen before, as well as new research needed.
All right, we talked about the good things, about the advances in medical technology. I'm curious to know, Terra, are we dealing with any kind of new maladies that have come about over the last few years that perhaps the BC Children's Hospital isn't accustomed to treating?
Well, yes, actually. There is something interesting that's happening right now, and that is in the world of diabetes. We're seeing children with childhood diabetes in numbers that we've never seen before. This is what some of the doctors here are calling a bit of an epidemic, quite frankly. We've got to figure out how we can control the diabetes and the number of cases that we're seeing, and how to treat them. We've never had to treat children in this number before, and so we need to figure out really what's causing the diabetes, and doctors are trying to do more education about eating healthy and keeping active, because the diabetes doesn't just have the effects on having to take your insulin and the possibilities that the side effects that come from diabetes, but also because of the obesity that is contributing to the diabetes. You're also seeing a lot of heart conditions that have never been present in children before. There's conditions that you only usually see in full-grown adults. So that's a real problem that we have to take care of right now.
I know you're not a doctor, you're the communications officer, but I think that we all heard that message loud and clear. Eat less and exercise more. The health of our nation is going to be a big cost down the road if we don't start paying a little more attention to this today, right?
And that's where our researchers are coming in, is to try to help find out what's really going on and how we can help prevent some of these problems in the future.
All right, Terra, I kind of wanted to talk a little bit here about the atmosphere inside the BC Children's Hospital. It must take extraordinary people to deal with such extraordinary circumstances when dealing with ill children. Let's talk about the feel inside the hospital. What's it like being there on a day-to-day basis?
You know, it's interesting. I meet a lot of families through the job I do here at the foundation, as well as caregivers. And you hearing the stories, you would think that a lot of the time it would be a sad place, it would be a hard place to be around. But that's not the atmosphere here at Children's Hospital. It's actually a fun place. The caregivers are laughing and communicating with families, and the families look, obviously they're going through the most stressful period of their life, but they are taking part in the care of their children, and that helps relieve the stress and gives them a sense of control over their environment, and they put so much faith in the caregivers. The caregivers here are truly amazing people. Like you say, it takes a very special person to do what they do, and but they realize that they have to keep things upbeat and positive and really help the families through this time. So it's actually it can be a fun place, especially on wards where the kids are well enough to sit up in bed and have visitors. The doctors bring around fart machines, and there's a therapist clown who comes around and plays the ukulele, and it can be quite a joyous occasion. It was just Halloween last month, and we had a parade of costumes throughout the hospital, and the kids went and collected their goodie bags, and the adults went around in full costumes with their little goodie bags for the kids who couldn't get out and join the parade. So it's a lot of fun as well.
Well, Terra, extremely noble work that you and the team at BC Children's Hospital are doing. It's small wonder that Team Matrix has decided to get behind your cause, and hopefully by the end of the race to $1 million, they'll be able to throw a little bit more money into the kitty on behalf of BC's Children's Hospital.
Oh, appreciate your time as well. We couldn't do it without support from our community, so thank you.